good afternoon and welcome to our media briefing. Today we're going to have an update on all of the information from Supervisor Fletcher. We're also going to have some comments made by our Undersheriff in the San Diego Sheriff's Department, Undersheriff Mike Barnett, and then Dr. Wooten will be going over the numbers as far as the COVID cases. For many, this weekend is the official start of summer vacation. And as many of you have been locked down for many, many weeks now, there's a natural excitement and anticipation about getting a chance to head out and enjoy activities that you haven't had a chance to do over these last few weeks. But this weekend is also when we honor our fellow Americans who paid the ultimate sacrifice in defense of our freedoms. And I want to touch on that because I believe it really relates to our current situation. From the beginning of this crisis, our main priority has been to protect public health and safety. As a result, we have taken painful steps that have impacted this entire region. But in the past few weeks, because of our steadfast efforts to flatten the curve, we have eased some of the restrictions we've imposed, including most recently allowing on-site dining and in-store shopping. All our hard work, however, can be easily lost. That's why we need to continue to abide by the public health order and practice physical distancing, avoiding large groups, and wearing facial coverings. We know it's a delicate balance we're trying to strike here. On the one hand, saying you can go out and eat at a restaurant, but on the other hand, saying that you have to wear a facial covering except when you're eating and avoiding standing close to other people. And we know we're fighting human nature. The human urge is to connect with people and shake hands and talk to people is very, very strong. But folks, if we want to continue moving forward in our recovery, we must continue taking precautions. As we have said repeatedly, the virus is not going away anytime soon. It's still out there causing death and pain and misery, and none of us are immune from it. When we talked yesterday about lifting some of the restrictions, we urged people to be responsible. Unfortunately, we have heard and seen evidence that not everyone is acting responsibly. So as we head into this long weekend, we're going to have to ramp up our enforcement of the public health order. We don't want to do this, but we can't afford to slip into complacency and allow a resurgence of the virus when we've come so far. So on this Memorial Day weekend, please remember the sacrifices of generations before us. Let us be an inspiration to each and every one of you today to do your part in the fight against this pandemic. Now, I'll introduce Supervisor Fletcher.
Thank you, and good afternoon. As Supervisor Cox just mentioned, we have a big weekend in front of us. Not only is it the traditional beginning of summer, but it is the first weekend with dine-in restaurants and in-store shopping open and accessible to San Diegans. Each and every San Diegan has given a tremendous amount throughout the duration of coronavirus pandemic. Your sacrifice and your commitment has paid incredible dividends as our region has done exceptionally well. This same sacrifice and commitment is what is allowing us to continue to progress through the reopening, and your ongoing commitment and your ongoing sacrifice is what will allow us to see that through in a smooth way. The actions that we've taken so far, actions around physical distancing, staying at home, hand washing, face coverings, temperature checks, these are the actions that are contributing to our success. But as we continue to go into this new phase, we have to be smart. We have to be responsible, and in certain instances, we have to hold one another accountable. We cannot afford to blow all of the progress we've made to date, especially as we head into a holiday weekend where it is harder and harder to try and stay out of situations that could facilitate outbreaks and spread of coronavirus. And as we see the implementation of the opening of dine-in restaurants, the implementation of the opening of in-store retail, we know the overwhelming majority of our businesses out there are doing everything that they've been asked to do, and we greatly appreciate them. But we also cannot be in a position where a few bad actors ruin the progress for an entire region. In the first hours, just within a few hours after us making the announcement yesterday afternoon about our region taking a tremendously positive step forward, we saw very troubling and very concerning instances of blatant disregard for the public health orders and blatant noncompliance. One of the most egregious of these examples was the El Prez restaurant located in the Pacific Beach area. And I'm going to play for you a short video of what transpired after we announced the changes in our public health order. Because we believe and we know the overwhelming majority of you have the best of intentions and understand the gravity and challenges of the situation we face. We, in almost every instance, prefer to work collaboratively. We prefer education. We prefer incentives. But heading into the weekend and seeing this in the first hours of our stay-at-home order being modified to allow in-person dining, we simply cannot tolerate such blatant and intentional violations of the public health order. Our public health order requires retailers, restaurants, and other businesses that are allowed to be open in stage 2 to ensure all required measures are implemented. It is also clear that any business that fails to comply with the county's safe reopening plans or the COVID-19 restaurant opening protocols may be required to close. After seeing what transpired at the El Prez restaurant in Pacific Beach, failure to follow the rules, today they were served with an order of the public health officer closing them effective immediately. This facility is now closed. This facility will remain closed until further notice. They will have the option to meet with public health officials to share their revised plans, to share how in the future they will ensure compliance with the public health orders and to make sure these types of situations do not happen again. And at some point in the future, this order by our public health officer, Dr. Wilma Wooten, can be rescinded, but they simply didn't do the basic things that we're asking folks to do. It created an imminent health and safety risk. The actions that you just saw in the video before you can trigger an outbreak and compromise our ability as a county to move further along in the state's reopening plan. Again, I want to reiterate that we know the overwhelming majority of our business owners and our restaurants out there are doing everything the right way, are very conscientious, they're very committed, and we appreciate each and every one of them. We also want to ensure a situation where the public has confidence that if they go into these settings that they will be safe, and we simply cannot let one bad actor ruin it for everyone. And as we head into this weekend, let us all be reminded that the dangers of coronavirus remain, that we have to be mindful of our actions, and we have to continue to demonstrate that we can work our way through stage 2 with the same commitment and the same excellent track record of success that we have done to date. And we urge the public to please be mindful of the dangers and have a real commitment to our actions to allow our recovery to continue. Our public health order, section 12, is being updated to reflect everything that has been shared in the recent days around restaurants. The order is now on our website at coronavirus-sd.com. We also want to provide 2 additional clarifications. Additionally, we've covered these in the preceding days. One is that hotels are to remain closed unless they are serving essential workers or they are aiding in the COVID response. Outside of that, staycations, reconnecting with families, Airbnb, all of these entities are not presently open and should not be operating. I also want to reinforce the beach rules. We've been doing an incredible job with our beaches. Folks have been following the orders, and we are working with coastal mayors on modifications to the current posture for our beaches. But for Memorial Day weekend, all of the current guidance remain in effect. You must wear a face covering and remain 6 feet away from anyone who's not in your household. You can walk or run on the beach, but at this point we cannot sit or lie down. If your beach allows dogs, then you can take your dog if your local jurisdiction allows it, and you can get in the water, swim, surf, paddleboard, kayak, snorkel, recreational boating in ocean, bays, and lakes, but only with members of your own household, and the beach parking lots remain closed. Again, each city and each jurisdiction has the ultimate authority over their specific beach, but those are the countywide metrics. Before I get to our daily charts, I want to just reiterate what Supervisor Cox mentioned is the importance of Memorial Day. As a combat veteran of the United States Marine Corps, the day has particular meaning and particular sadness for those of us who came back when our friends didn't. And as we head into the weekend, we are reminded of that notion of sacrifice, that notion of people willing to make the ultimate sacrifice in giving their own life for one another, for someone else, and for this country. And it's not lost on me the irony that a country founded on sacrificing life in order to preserve liberty is now facing a situation where we're asking the public to sacrifice liberty in an attempt to preserve life. But when we think about the tremendous sacrifices that were made around Memorial Day and what we think about simply asking us to wear a face covering, to limit our gatherings, it doesn't seem quite so intense, and it doesn't seem like such a burden. And so as we head into this Memorial Day weekend, let's make sure that we honor those who made the ultimate sacrifice for our country and never lose sight of what the true meaning of sacrifice means. We will jump into our update charts here. The first one I want to share is around Operation Shelter to Home. We have been repeatedly updating current available bed capacity. Last chart for you today is our ICU situation. There you can see our COVID-related ICU census. The other ICU patients puts us at 428. The green bar there is current ICU bed capacity. The blue line is the licensed capacity for our region. And you can see right now we're sitting at about 66% occupancy out of our current ICU bed capacity. That completes my section of the report. Next, I'm going to turn it over to speak about enforcement and the posture and the importance of compliance throughout the weekend. I'm going to welcome our Under Sheriff Mike Barnett.
Thank you very much, Supervisor Fletcher, and good afternoon to everyone. Law enforcement is very concerned about reports of large crowds gathering at bars. Our biggest concern is that if we are not successful in this reopening, we run the real risk of having a setback. The fact of the matter is, having people in an enclosed space, such as a bar, not keeping the proper distance between one another, puts everyone at risk. San Diego County has over 3 million people, and we have all been slogging through this situation for well over 2 months now. The Sheriff's Department is the primary police agency for 9 contract cities and all of the unincorporated communities in San Diego. That is almost 1 million people altogether. Our deputies have issued only 137 citations thus far, and none in the past 7 days. So about 1/100th of 1% of the population has been cited. We are not looking to increase this, but we all need to work together. Let's treat Memorial Day weekend as it should be treated, with solemnity, not with celebration. Our deputies are trained professionals. They do enforce the law, but they have discretion in how they go about doing so. The overwhelming majority of the time they engage in two-way communication, attempt to educate about what the public health order says and why it says it, listen to the concerns and questions raised, and ultimately gain voluntary compliance. On rare occasions, we are left with no choice but to issue a citation or document the facts so that a warrant can be sought down the road. Deputies have that discretion, and they will use it to enforce these orders. Honestly, law enforcement would rather be seeking out and arresting real criminals than responding to calls about normally law-abiding citizens engaging in activities that under any other circumstances would be perfectly fine. We have our hands full investigating real crimes and must deal with the current statewide zero bail order, which is keeping dangerous criminals out on the street rather than in jail. We are more than willing to work with the public to educate them about what the public health orders say and what they do and do not permit. We have pushed out comprehensive training bulletins to our deputies and shared them across all agencies in the county on a regular basis as the orders have evolved and changed. The bottom line, though, is that the orders exist for a reason. They apply to everyone, and they need to be followed lest we see a new surge and must ratchet back. No one wants that. I now would like to introduce our Public Health Officer, Dr. Wilma Woot.
Thank you, Under Sheriff Barnett. Good afternoon, everyone, and welcome to today's media briefing. For COVID-19 statistics ending this week, global, national, and state statistics provided or based on data from the Johns Hopkins dashboard, which was obtained approximately noon today. Globally, there are almost 5.2 million positive cases, including over 335,000 deaths. Nationwide, the United States is reporting almost 1.6 million positive cases, still 31% of the global number, and includes over 95,000 deaths. Statewide, California is reporting over 88,000 positive cases, which include 3,604 deaths. Today, the County of San Diego is reporting 6,434 cases, which is 119 more cases than were reported yesterday, as well as 242 deaths, which includes one new death reported since yesterday. The age range is still the same, from 3 months of age to 101 years of age. 3,327, or 52% of the total number of cases are between the ages of 20 to 49 years of age. The gender is 50% split between male and females, and we have 1,209, or 19% of the total number of cases hospitalized. And that is, again, a cumulative number. Of the hospitalized number, 361, or 6% of the total number of cases, have been admitted to the ICU, and 30% of the total number, and this represents 30% of the total number of those hospitalized. For today, May 22nd, the county has surge capacity for hospitalization at 37%, and for ICU beds at 34%. The 242 deaths represent approximately 4% of the total number of cases. And of the one additional death that is being reported today, this individual died several days ago, last week, The individual was 35 years of age and had underlying medical conditions. Also, of the 242 deaths, 43% are female, 57% were male. 233 had underlying medical conditions, which is 96% of the total. And 8 individuals of the total have no underlying medical conditions. My sincerest sympathies, again, go out to the individual that we reported today, who unfortunately lost their life to COVID-19. As a reminder, all of our data and our statistics can be found on the website that's on most of the slides that you are seeing today, and also that's on the sign in front of me. So in regards to reported outbreaks in congregate and community settings, to date, there have been a cumulative total of 75 confirmed active outbreaks. And these numbers may change for whether it's congregate or community setting. For community settings, the definition changed some time back, so that eliminated 4 of the settings that were originally on our list. And also for congregate settings, when there are no longer any active cases since 14 days, then they become inactive. So we are reporting every day the number of active outbreaks. And to finish up this report as it relates to outbreaks, we had now 52 active outbreaks in congregate setting facilities, and we had 2 new outbreaks reported since yesterday, with a total number of congregate cases at 1,454 cases, which includes 120 deaths, and we have 23 active outbreaks in community setting locations, which include 301 cases and 5 deaths. Lastly, regarding local metrics, they continue to trend in the right direction, but if we continue to see situations as has been shared with us today by Supervisor Fletcher and Chairman Cox, these numbers, our metrics could begin to trend in the wrong direction. So I am asking all of our San Diego County residents, businesses, and organizations to please adhere to the health officer's orders. Now, please welcome back to the podium Supervisor and Chairman Cox.
Let's go directly to the questions.
Artie Ojeda with NBC7, please state your question.
Good afternoon, everybody. Happy Friday. Today's case in PB was obviously egregious and the place was shut down. But I want to ask you about cases that are less egregious, because over the past few weeks, we have spoken to several law enforcement agencies, and they are choosing to educate rather than cite. You know, we heard the undersheriff just say that, that there's just been a minimal number of citations. And I know you're leaving it up to the local jurisdictions, but if they're not issuing citations, what is the incentive for these businesses to close down if they're open in violation of a public health order?
Okay, I think Supervisor Fletcher is going to start to answer that, and there may be some follow-up.
Thank you, Artie. Look, the simple reality is law enforcement has a hard enough job as it is. They have a tremendous obligation to protect us, and that hasn't gone away in the coronavirus pandemic. And you mirror that with the reality that they shouldn't have to enforce these types of things. The public health orders are not put in place out of a desire to tell anyone what to do. There's no joy in doing it. It's put in place in order to protect lives, to protect public health. It's put in place to allow us to reopen. And so the broader scale compliance we get ensures the continued progress we make, which means we get to continue to move it forward back to getting some semblance of our lives back. And so we continue to work with the public to try and get widespread adherence and try and get widespread compliance. I'll tell you at the outset of this, we had tremendous compliance, which is why we did so well as a region. And as we come out of it, we're going to strive to continue to do that. Law enforcement has the authority to enforce when they believe in their discretion it is appropriate, and they have And as you've seen with the instance in PB, our public health officer has the authority as it relates to businesses to enforce. But we would much prefer to work with folks to educate, to encourage, and then when you see really egregious examples, either law enforcement or in the case of a business, there are obviously other means available. But we would much prefer that we all work through this together, and it's our hope moving forward as we go through this that we can adapt and we can get used to the things we're doing and we can continue to see progress.
Supervisor Fletcher, those points are well taken, but the fact of the matter is we are seeing businesses in less egregious ways and, in fact, being very mindful of public safety and cleanliness, they continue to be open in violation of the public health order. So, would you like to see local law enforcement issue more citations because obviously education isn't working?
Well, we'll continue to monitor as we go through. You have seen instances in jurisdictions where law enforcement has stepped in and closed some. You've seen instances where public health orders have been issued to do it. But what we would like to see is getting to a point of broad-spec compliance, and when there's egregious wrongs, then there are other things that are there. But I think, Artie, we're all trying to work through this, and we're trying to do it in a spirit of collaboration as best we can. And then when there are egregious violations, there are other mechanisms that are here. And I don't know if Dr. Wooten or Under Sheriff Barnett would like to add to this. But again, we're trying to get through this in the most appropriate way, in the least heavy-handed way, but also in the way that protects the public. And so we'll continue to work through a very unprecedented and difficult situation as best we can.
Thank you.
Artie, just briefly, I would like to just point out the fact that we all have a role to play. And what law enforcement is doing in terms of the education is a part of that. But also individuals out there in the public, when you see a situation, we're not asking you to approach individuals or businesses, but if you see a situation that is not in compliance with the health officer's orders, there is an opportunity to go to 211 and to lodge that complaint, and then it will be then directed to the jurisdiction where that particular complaint was, where the issue or the situation occurred. But again, everyone has a role to play. So the health officer's order is what we're doing to let people know what is expected. Law enforcement educates, and the general public can let us know because law enforcement can't be everywhere. So again, the take-home message here is that everyone has a role to play.
Thank you, Dr. Wooten.
Just one additional comment. The best number to call if you see violations is the non-emergency number for the local law enforcement agency. That's the preferred number for people to call. Let's go to the next question.
Alexis Rivas with NBC7, please state your question. Alexis Rivas?
Hi, yes. I'm just curious, how many businesses were shut down today, or I should say, kind of hand-delivered these county orders to shut down immediately for violating the social distancing orders for dine-in eating last night?
Okay, I'll ask Supervisor Fletcher to respond.
Thank you. It was just the one entity in Pacific Beach. That was the only one.
If I could ask a follow-up. So the photos from last night at El Pres were shared all over social media. We all saw them, and they'll be catching that violation easy. But what about places that won't have photos posted online? I mean, what is the enforcement effort going to look like? Can we expect patrols specifically looking for violations of the order for these dine-in eating establishments in particular?
Well, we can't respond to something that we don't know about. So to the extent that there are violations, again, law enforcement is a mechanism, and I know we've been in contact throughout the day with San Diego Police Department about clarifying and making sure that it is clear in our health order what are the requirements on restaurants as we head into a busy weekend. But again, we expect that the overwhelming majority of restaurants are doing the right thing. The ones that don't tend to get all of the attention, and that's certainly the case in this instance. And sometimes the ones that don't rise to a level that requires some enforcement that is something we don't standardly or commonly do. But our expectation and our hope and our belief is that as we head into the weekend, the overwhelming majority of folks are going to do the right thing because it protects their employees, it protects their customers, and it protects our region. We want to continue to move forward. Dr. Wooten has outlined the metrics that are in place, and if we see significant spikes, that will stop our ability to move forward. And those are laid out in the numbers. And so we're asking everyone, we got to all do our part and act responsibly and make sure that we can continue our forward progress.
Thank you.
We'll go now to the texted questions. The first one deals with contact tracing, and Dr. McDonald is going to go ahead and answer that question.
Yes, this question is from Paul Sisson with the UT. Is the county able to call all close contacts of newly confirmed cases? What is the current average lag time between receiving information on a newly confirmed case and full investigation, including close contacts?
Thanks for giving me an opportunity to talk a little bit about contact tracing. That's a great question. Our goal when we learn of a confirmed case, usually by laboratory, but sometimes from providers, is to be able to do an investigation to identify all those close contacts within 24 hours. That usually means talking with the patient's providers, or sometimes their family. Then, once we have a list of close contacts, our goal again is to identify, to talk with each one of those individuals within 24 hours. Now, it's often best for the patient and the provider, when they first learn of the diagnosis, to actually start that process of identifying and notifying close contacts. It's usually family members. And so by the time we learn about the case and actually talk to those close contacts, they're usually already aware that they are close contacts, which is a good thing, because we don't necessarily want public health to be the first person to break that news. But we are actually able to go ahead and do the close follow-up and be sure that all the right isolation measures are taking place, and any support that those individuals need during their time of isolation are in fact provided. So we'll have to get back to you on the exact average amount of time. That's not a metric that I know off the top of my head, but we can look into that. But we have goals to complete investigations within that 24-hour period.
All right, thank you, Dr. McDonald.
This next question deals with testing in the backcountry, and Nick Mascione, our Director of the Health and Human Services Agency, will respond.
Yes, this question is from Michael Hart with the Julian News. Today's announcement of backcountry testing only goes through May 30th. Are there plans for June?
Great question. We actually are testing in Julian not only on May 26th from 9 to 2 at the County of San Diego Library. We'll also be offering testing on June 5th as well. As a reminder, for the backcountry, working with CAL FIRE and the San Diego County Fire Authority, we're going throughout different communities in the backcountry. We're asking folks to call 211. These are by appointments, and there are drive-ups. And we'll be continuing that process throughout the backcountry as long as the need's there. So you call 211, schedule an appointment, and it's a free test.
All right. Thank you, Nick Mascione.
These next two questions are really going to be directed to Dr. Wooten, and I'll let the question go ahead and proceed.
Yes, this is from Pam Cragen with the Union Tribune. Have any diagnosed cases of COVID-19 in San Diego County since mid-March been traced to restaurants doing takeout or traced back to any restaurant workers? And Dr. Wooten is going to start this answer.
So the question, have any cases been traced to takeout restaurants? Is that correct?
Yes, since mid-March, any
Yeah.
positive COVID-19 cases?
Well, every day we report the congregate rather, and the community settings, and that would be in community settings. And to date, we do not have any outbreaks associated with restaurants or takeout facilities. I'd just like to remind everyone that individuals could work anywhere, but we have not had any cases that have been linked back to takeout facilities resulting in an outbreak.
Okay, and this question is from Kim Miller with ABC 10. One might say this weekend is the ultimate test of social distancing. Would you agree that San Diego's grade this weekend will set the tone for the entire summer? Could ignoring guidelines cause the county to dial back on allowing the public to be active?
Absolutely, as is indicated in and provided in our attestation form that was submitted to the state on Tuesday. We have metrics that we are following, and there are particular triggers that we are following that are in epidemiology or surveillance, hospital or capacity, as well as public health response. And we will be closely monitoring those metrics and even tweaking them and maybe adding others as we progress over the next ensuing weeks and months to make sure that we can clearly follow what's going on out in the community as we increase or modify the stay-at-home order and include more businesses. So that is something that is a necessary part of reopening up, monitoring to make sure that there is no increased spread of COVID-19.
Thank you, Dr. Wood.
Well, that's it for the questions today. Before we head into the weekend, though, I want to remind people that we're going to continue to do testing during the holidays. This Sunday, May 24th, testing will take place for the next 2 weeks on Sunday, Wednesday, and Friday from 10 a.m. to 2 p.m. at St. Anthony of Padua Parish in National City, and that's located at 410 West 18th Street. This is being done in partnership with National City Mayor Alejandra Sotelo Solis, and we very much appreciate her cooperation and support as we continue to increase testing options in the South County area. We will continue to have the county's Live Well on Wheels mobile unit offer COVID-19 testing from 9 a.m. to 3 p.m. on Saturdays at the Euclid Health Center, which is located at 292 Euclid Avenue. 2 state-run walk-up test sites are now in operation in southeastern San Diego and in El Cajon. One is located at the Tubman Chavez Center at 415 Euclid Avenue, and the other at the former San Diego County Assessor's Office located at 200 South Magnolia Avenue in El Cajon. They can do up to 132 tests per day. And we have more testing in Mission Valley at the stadium and in Escondido and Chula Vista. To schedule testing, you can call your healthcare provider. You can visit our website at coronavirus-sd.com. You can contact the state at 888-634-1123. That's 888-634-1123. Monday through Friday from 7 a.m. to 7 p.m. The line is available in both English and Spanish. Or you can access the county's public health nurse line by calling 211, selecting your language, and pressing. Again, just a reminder, we will not be holding a briefing this Saturday or Sunday or Monday in observance of Memorial Day, but we will return on Tuesday at our regular scheduled time at 2:30. So until then, please enjoy the weekend and stay healthy. Thank you.